Thank you, Keir. I welcome the opportunity to contribute to this private members' debate tonight on the crisis in the emergency departments in our hospitals. Minister, this situation, as has been said by other speakers, is nothing new. Today in Letterkenny General Hospital, there are 11 patients on trolleys. Yesterday there were 31. And this is not a new situation for Letterkenny General Hospital. Indeed, the citizens of Donegal and the staff of the hospital are all too familiar with it. Just looking back on taking one random day in a number of months last year, in March 2014, 19 patients were on trolleys in Letterkenny General. In May 2014, 22 patients were in trolleys. And in September 2014, 12 patients were in trolleys within the hospital. And that's the ongoing situation. So while we might have a spike now because of the winter conditions and the increase in respiratory complaints for the elderly and patients needing care, this situation has been ongoing for years in Letterkenny General. And the reason for it is that over the last 6 years, your government and the previous government have taken over €3 billion out of the health services. And it's not possible to run a health service with those level of cuts. The only way that you can actually work within those budgets is by maintaining queues. Whether those are queues of people waiting on waiting lists to get access to see consultants and get access to hospital, or queues of patients on trolleys in emergency departments. And that is the way that that is the only way that the budgets can be controlled, and that is the system that you are presiding over and that the health services are presiding over in this country. The only way that you can solve this problem is by making long-term investments. And the only way that we can make savings is on a long-term view. We need to invest, and you need to invest in the health services now. You need to invest in opening extra beds within our hospitals to ensure that patients can be catered for, provide the long care and stay care in the community hospitals so that patients can be moved on out of our hospitals. But the nub on that is that if you do provide extra beds in community hospitals and nursing homes, you actually won't save any money, because by freeing up the beds in the hospitals, another patient will move into them straight away, and it's actually costing money. And that's the reality within our health services. And I believe that that's the reason why we have these delays and why we have people sitting on trolleys. It's because within the Department of Health and within the HSE, in order to control your budgets, you are controlling access to the hospitals.
Thank you, Deputy.